So Manjula, once we're live, just let us know.
We are live now, doctor.
Okay. So very good evening, everybody. The World Glaucoma Week, this starts soon, and YOSI is celebrating this as in the form of the YOSI World Glaucoma Week webinar. It's a very interesting webinar, and we have the pleasure of having some global experts with us, and we will elaborate as we go on. But before this, let me just start by introducing our YOSI team. Can we have the previous slide, Arshi? Yeah. Can you go on to the next slide? Yeah. Okay. So the one slide has been missed. So this was the YOSI Governing Council, and this is the YOSI Executive Team. So YOSI Governing Council, Dr. Divakan Misra, Dr. Sonal Kalia, Dr. Nilesh, Dr. Aditya, Dr. Prasanna, and Dr. Karan Bhatia. And this is the Pan-India Executive Team who's been working very hard to bring YOSI where it is today. Next slide, please, Ashi. Yeah. So YOSI over time has, grown a lot of wings to it. A lot of presidential working groups were formed by Dr. Sonal, and the current team has really taken it forward. And one of them is the socio-cultural team. So we deal with the extracurricular aspects of the young ophthalmologists relating to ophthalmology. And these are the various activities that we've done over the past 2-3 years. So be it reels, photography, creative contest, Rangoli, art, poems, we have it all covered. This is the socio-cultural team, me being lead, Dr. Rakhi D. Cruz, Dr. Priya, Dr. Sunamni, Dr. Lippi, and Dr. Nandita. One of the other groups is the glaucoma focus group, which is headed by Dr. Arshi. Then we've had a plethora of activities. We celebrated the Youth Day. We also celebrated the cornea donation fortnight. Then we also celebrated the ICI webinar contest, the World Photography Day. Then we had the Aussie World Tourism Day, wherein we had reels pertaining to conferences. We had the International Creativity Contest, and then we also celebrated Children's Day as the Aussie Yo-Yo, Young Ones of Young Ophthalmologists. We celebrated Christmas with a Christmas concert. We celebrated our mentors in the form of Celebrate Your Mentors Season 1 and Season 2. We also celebrated the World Earth Day, wherein we had reels and artwork relating to sustainability in ophthalmology. And then we also celebrated our Indian Independence Day as an online concert with patriotic songs. We had the World Sight Day 2025. And with this, the socio-cultural team turned 4. We celebrated our 4th birthday, and we have our logo. This was the beginning that we had the first webinar ever for socio-culture with the creativity contest right in 2022 under the guidance of Dr. Sonal Kalia, the then president. And after that, there has been no looking back. And then these have been the plethora of activities. We had the Dronacharya Awards, and we had the Glaucoma Week webinar last year. So Glaucoma Focus Group is headed by Dr. Arshi and a wonderful dynamic team. And in collaboration, we celebrated this last time, and we're having this today. So we have these two contests, which is the Glaucoma Awareness Through Art and Glauco-Yo Reels, where young ophthalmologists have submitted their creativity in creating glaucoma awareness. And we are extremely happy to have some wonderful entries. And over to you, Dr. Prasanna, to introduce our chief guest for today.
Thank you, ma'am, for an elaborate history of the socio-cultural team, which we all know is your baby and one of the dynamic arms of Young Ophthalmology Society of India. The first chief guest for today, I think sir needs no introduction. He's the president of GSI. And I always keep telling sir that if he was not there, I would have never ended up taking up glaucoma. So I think that's the introduction that I always prefer for sir. So Dr. Satyan sir is leading his own setup at Dr. Satyan Eye Care, and he is currently the president of GSI. Thank you, sir, for being here despite your busy schedule. And next, again, we have another international chief guest with us today, Professor Madhuvanti Disanayake, ma'am. Again, ma'am is also my teacher. Ma'am has been along, and I've learned for the last 2 years in the APAO forum, in the leadership development program, one on the other side, as well as now part of the council as well. And I've learned a lot from ma'am, and she has always been very supportive of many activities. And she's currently in Sri Lanka, and she's also a professor and numerous accolades, and especially in genetics, anatomy, and faculty of medicine. Thank you, ma'am, for being with us not once but multiple times for YOSI. Thank you, and a warm welcome to both the chief guests. With that, handing it over back to Nupur ma'am for the judges' introduction.
Over to you, Arshi, to introduce our esteemed panel of judges.
It's my pleasure today to introduce our panel of judges. We have judges from all over the world today, and we welcome you all to the webinar and for the start of the Glaucoma World Week this time. So we have Dr. Mayuri Kamar. Ma'am is a glaucoma specialist at Raghudeep Eye Hospital, Ahmedabad, and has been awarded multiple awards like the DB Chandra Award and the Best Paper Award by the GSI, and is a prominent glaucomatologist. Thank you, ma'am, for being with us today. We have Dr. Kirti Singh, ma'am. It's my proud honor and privilege to introduce her today. She's a Director Professor of Ophthalmology and the Chief of Glaucoma Services at Guru Nanak Eye Center, Maulana Azad Medical College. And she's also been my mentor throughout in my glaucoma journey. Ma'am is a fellow from Wills Eye Hospital and a FAMER fellow, and is a prominent teacher who loves publication as well as mentoring new glaucomatologists. Thank you, ma'am. We have Dr. Anak Angung with us. She's an ophthalmologist at JEC Eye Clinic Bali and also at the Tuban Bali Hospital. Madam did her education in the Bali Udanya University and is a member of various organizations and has done her fellowship in glaucoma management in 2024. Thank you, ma'am, for being with us. We have Dr. Swati Upadhyay, ma'am. Ma'am is a glaucoma specialist at Arvind Eye Hospital, Pondicherry. Again, multiple awards to her name with the Best Paper and Best Poster Awards at GSI and in the Coimbatore Ophthalmological Society, and Best Video at the AGS and the AIOS. Thank you, ma'am, for joining us. We have Dr. Ramya Shri, ma'am, again, one of my teachers. She's a wonderful person. She has trained at LV Prasad Eye Institute and is a glaucoma consultant at Drishti Eye Center, Hyderabad, with multiple publications to her name and authored chapters in the book Ophthalmic Diagnosis by Elsevier. She's been awarded by Dr. APJ Abdul Kalam the Excellence Award in 2025. Thank you, ma'am, for joining us. We have Dr. Alka Pandey, ma'am. Dr. Alka Pandey, ma'am, is an anterior segment consultant at I7 Eye Hospital in New Delhi for the last 20 years, is a prominent glaucomatologist herself, did her post-graduation from BHU in 1999, and involves in her field of interest MIGS and other newer glaucoma surgeries. Again, thank you for sparing your time, madam. Then we have Dr. Emmanuel Franco Gomez. Sir is a doctor in training at this point of time at the institute. Can you help me with the pronunciation, please? At the Guillermo Avalos Urze Institute. Is that right? Because I hope I haven't got that right. Thank you so much for joining us. We're very happy to have you. He's been at Madrid as well and in various other places. So it's nice to have everyone. Then we have Dr. Aline Sid Garcia. She is from Yucatan, Mexico, and did her education in Mexico as well. She has extensive research experience in glaucoma and ophthalmogenetics, especially in home exome sequencing in primary congenital glaucoma and MYOC gene identification in JOAG, and multiple publications for the same. Thank you, madam, for being with us. Then we have Dr. Maria Isabel Arias Gallardo. I hope I'm saying all of these names correctly, and thank you so much for joining us. She's from Mexico as well and has been an instructor in various courses of histology and histopathology department in Mexico. Then we have Dr. Mohammad Iftikhar Iqbal. Sir is a consultant of glaucoma services at Bangladesh Eye Hospital and a pioneer of MIGS in Bangladesh, one of the first adopters of Trabex Pro and the B-Bank technique, G-Flow shunt, a lot of newer innovations to his name, and also is a very prominent researcher. Thank you so much to all of our judges. I understand how precious your time is, so we're not going to waste a single second of it and introduce our moderators. Over to you, Dr. Lippy.
So the moderators for today's session are one and only Dr. Nupur Goyal ma'am. She is currently a consultant at Eye Care Eye Hospital and PG Institute, Noida, and she is also the team leader of YOSI Socio-Cultural Activity and YO Times. Next is Dr. Prasanna Venkatesh Ramesh. Sir needs no introduction. He is currently the Joint Secretary of YOSI and also the Director Head and Glaucoma Head at Mahatma Eye Hospital, and has a lot of awards to his name. Our next moderator is Dr. Arshi Singh. She is an assistant professor at Maulana Azad Medical College, New Delhi, one of the dynamic executive YOSI member and also the glaucoma focus group leader. And the last moderator for today is myself, Dr.
So I'll
Lippy.
introduce you Dr. Lippy. So Dr. Lippy is an executive member of YOSI, team lead of the cataract focus group, and a very, very dynamic young ophthalmologist member, YOSI member. She's got a lot of awards to her credit, and she's currently working as a consultant cataract and refractive surgery center for Site Palwal.
Thank you.
Arshi, we've reached the last slide by chance.
Program
Can
is
you
over.
just, yeah. So with this, I think we can have Dr. Nilesh, who's our secretary, to give the GC address. Over to you, Nilesh.
Thank you so
Actually,
much,
can you
ma'am.
stop
It is-
sharing and just work on the, yes, yeah.
Thank you so much, ma'am. It is always a good privilege to be a part of social cultural webinars, and we keep celebrating all the days that are there for ophthalmology and also beyond that, and somehow that vibrancy keeps YOSI alive, I think, because otherwise it would have been very dull to be in YOSI if social cultural was not there. And I feel really proud to see so many international and national faculties together at one platform of YOSI, and thank that is all due to Prasanna sir's untiring effort and well coordinated by Arshi ma'am and Lippy and you. So looking forward to this webinar today, and all the best. Thank you.
A few words from you, Dr. Prasanna, as well, and
Yeah.
then you can just take the comments from our chief guest.
ma'am.
Yes.
Yes, ma'am. Thank you, Nilesh. I mean, you are being very humble for giving us this opportunity and also bringing us all in one roof. And to all the viewers out there, we have our annual Congress YOSICon 10, 11, and 12 in July. If you are watching it, we would definitely love to have you all here physically as well. Just extending another warm invitation from our secretary, Dr. Nilesh. We would like to invite you all, and without any further delay, we would like to hear from our chief guests who have patiently waiting to share their address. First, we'll take Dr. Satyan sir's address, our GSI president, who has done tremendous work for India in the last 1.5, 2 years in his tenure. Over to Dr. Satyan sir, and he still has a lot of innovative ideas for the next 6 months as well. Over to sir.
Arshi, can you stop sharing your screen for a while? Yeah.
Yeah. Wonderful evening to every one of you. And I'm so proud of all of you. The AOC, you are our strength and you are our future. Such a great pleasure to be with you all today for this wonderful meeting. And I don't think I have any words to, express my sincere thanks and, like whatever you say, because you are all doing great. And it is time that we focus on the glaucoma. We know that glaucoma in India, especially, we have the highest population, like how we have the diabetes capital of the world. So we have about 20, close to 20 percentage of the world glaucoma population is in India. So it is time for us to have more awareness. So I wouldn't say this is basically a celebration of World Glaucoma Week. I would say this is a World Glaucoma Awareness campaign that we need to take it down to the each and every one of our family members, neighbors, relatives, friends. So it's time for us to do that. One, how much of a knowledge that we can gather about the disease. After practicing glaucoma for almost close to ever since 1992, it's almost like 33, 34 years. Now I see glaucoma in a very different perspective. Because what we have been taught as an IOP as a disease, now it is more of a neurodegenerative or whatever you call it, as a kind of completely a different disorder that glaucoma has become. When we are looking at the optic nerve head, we see the disc today in a very different way. Without doing your fundus photography or OCT, when you are looking at your visual fields, it has no meaning to it. That's what I have understood today. Just looking at the visual fields and having some defects in the visual fields, if you're going to pick up that glaucoma and then you are going to say that there is a progression of the disease, probably we are mistaken. So there is so much has changed when we are looking at the retinal nerve fiber layer, optic nerve fiber, the retinal nerve fiber layer today. We were thinking where, like superior arcuate defect or inferior arcuate defect is glaucomatous change, but it is the PMB, that is the papillomacular bundle. The damage is there. 70% of the time it is getting affected in glaucoma than the superior or the inferior arcuate bundles. So the knowledge we gather today is so much that we have to reinvent when you are diagnosing the glaucoma. So it is wonderful meeting that you have organized, and I wish all the very best for this meeting. And unfortunately, the GSI is not going to have the World Glaucoma Week starting on 8th, but we are going to have the World Glaucoma Awareness campaign by GSI probably in the third or fourth week, or probably even the first week of April, as all of us know that the AOS is there. So most of the people are preparing for the AOS, so we are not going to have the very active campaigning. But I'm really happy to see that the YOSI is doing that, and I'm really proud of. So I think I will not take much of your time. And thank you, Prasanna, Kirti, and the entire team for giving this invitation to me, and all the very best for all of you. And let's start serving our own people.
Thank you.
Thank you so much.
Thank you, sir. Always a pleasure to keep learning from you. And I think we all learned another 1 or 2 points from you, right from the.
Within that, you have started learning. That's wonderful.
Thank you, sir. Thank you as always.
Thank you, Prasanna.
Grateful to you, sir. With that, moving from one teacher to another, Professor Madhuvanti ma'am, who is our international chief guest for today. Ma'am, a few words from you for this initiative of YOSI.
Thank you, Prasanna. Good evening. Chief guest Dr. Parthasarathy, President and the Council of Young Ophthalmologists of Society of India, members of the YOSI Socio-Cultural and Glaucoma Focus Groups, esteemed panel of judges, and distinguished invitees, colleagues, and friends. It is truly an honor and a privilege for me to join you as an international chief guest at this celebration of World Glaucoma Week 2026 webinar organized by YOSI. And I bring warm greetings from Sri Lanka, the beautiful island in the Indian Ocean, and from many colleagues out there who share the same mission as all of you to unite for a glaucoma-free world. First of all, I would like to congratulate the young ophthalmologists of India who is organizing this event, bringing it to an international level. I also acknowledge the hard work of all the participants for submitting their entries of this standard with a great educational value, novelty, and creativity. It is encouraging to see the next generation of ophthalmologists taking leadership in raising awareness about glaucoma. Your enthusiasm, energy, and commitment is exactly what we need for our profession. As you are aware, glaucoma is a silent disease where slow damage of the optic nerve leads to vision loss. And if not detected and treated early, it will lead to vision loss. So it is aptly named the silent thief of sight, as you all know. Therefore, awareness programs are very important to educate the public. Even a simple message like get your eyes checked if you're over 40 or if you have a member with glaucoma will take the life of a patient, will change the life of a patient. So it is very important to organize this type of work, especially by the young ophthalmologist. I also take this opportunity to acknowledge the senior ophthalmologists and teachers who actually has done great work. So in this forum, I'm sure that each ophthalmologist is standing on the shoulders of mentors who guided them and trained them and inspired them. So I think the effort of all those have been very worthwhile. So actually, without taking much time, I would like to again congratulate the organizers for bringing ophthalmology into this level and bringing the world together in this time where the world is drifting apart. So in conclusion, I would like to wish all of you all the very best in all your future endeavors. Thank you very much for inviting me. Thank you, Prasanna, as well.
Thank you, Professor Madhuvanti ma'am, and as well as Satyan sir for the wonderful words for our young ophthalmologist and for being here despite short notice. With that, I'd like to hand over to Nupur ma'am to kickstart the proceedings of the day.
Yes, so thank you, Satyan sir, Madhuvanti ma'am. And without further much ado, let's begin with our first entry. Before that, I just like to make a note to all the judges that hope you have received the Excel sheet, and you can just keep marking that, and just send the filled Excel at the end of the webinar on my personal message or mail, and we will be announcing the results in 2 to 3 days, and the winners will be awarded at the 3rd annual YOSI Con at AeroCity, Pullman, New Delhi. So that's it. So over with this, and now we'd like to begin. Arshi, can we have the first entry for the day? So our first participant is Dr. Anirudh Gupta, who submitted an artwork. He's a DNB ophthalmology final year at Netradama Super Specialty Eye Hospital, Bangalore. And can we have his artwork, please, Arshi? And Dr. Anirudh, I would like you to please unmute yourself and describe what you have submitted and presented. It looks so beautiful. Over to you, Dr. Anirudh.
Good evening, ma'am. Thank you. Thank you very much. So, as glaucoma is said, the silent thief of sight. So, centrally, I have made an eye, which is the world which is bright around the central iris. And there is a pressure gauge, because pressure being the most common and the only modifiable factor in the glaucoma. And then there is a thief who is trying to steal the vision. So basically, the poster portrays rising intraocular pressure is a ticking gauge within the pupil, silently compressing the optic nerve, and the narrowing beam of vision symbolizes the gradual visual field loss. While the fleeing thief represent the stolen peripheral sight, though the world around it is still bright. So early diagnosis is the key, and regular follow-ups. Green ribbon being the sign for glaucoma week. So that I have added to that.
Yeah. Thank you, Dr. Anirudh, for that wonderful entry, and it's a really creative one. I'll request
Thank you, ma'am.
Dr. Madhu ma'am to say a few words about this creative artwork. Ma'am, Madhu ma'am, you're there. Okay, so I think Dr. Madhu ma'am probably is having some issues with the network. Dr. Mayuri ma'am, if you can just make some comments on this wonderful creative artwork.
I should congratulate you on giving such a beautiful art, which has
Thank you.
everything, almost everything. The most beautiful thing that I liked is the thief is carrying the optic nerve.
Thank you, ma'am.
Secondly, the color halos, which is also one of the early signs.
Thanks.
And you have given almost everything that is to be told to the public. So very nice.
Thank you,
Very
ma'am.
nice.
Thank you, ma'am. Dr. Kirti Singh ma'am, a few comments from you about this, about this artwork.
I like the congratulations, Dr. Anirudh.
Thank you,
I
ma'am.
like the concept of the pressure, which is the only thing we can control. And I like that, the signature, Dr. Anirudh Gupta is made like a ECG, is it deliberate or I don't know. And the silent thief also has a similar scroll through it.
Yes, ma'am.
So it's like ticking, everything is ticking and going. And the best part is the preserved vision. There's a white circle after the black,
Yes, ma'am.
right? Is that because the pressure is rising? You have written it for that, but I think the white part also is as important. So the colors are
Yes,
very
ma'am.
nicely chosen.
Thank you,
So
ma'am.
great.
Thank you, ma'am. Dr. Anak, your comments, please.
Thank you and congrats to Dr. Anirudh.
Thank you, ma'am.
Maybe I'm the same with Dr. Mayuri and Dr. Kirti Singh. You present the illustrated overall is very nicely, and the glaucoma is often called the silent thief of sight. I think you already highlight the so the public maybe can reflects that the concept is very well. So for me, it's very nice. Thank you.
Thank you. Thank you very much.
Thank you, judges. Thank you, Dr. Anirudh. We
Thank
hope
you,
to
ma'am.
see more of you in the future YOSI events as well. And
Sure,
with
ma'am.
this, we move on to our next participant. Arshi, can we have the next slide, please? So our next participant is Dr. Manju M. She's currently working as a consultant ophthalmologist and glaucoma specialist at RAI Hospital, Eye Care, Thrissur, Kerala. And she submitted a very wonderful reel. We can just play the reel and then hear from Dr. Manju. Arshi, can you play the reel, please?
Good morning, Mr. X. You're early today.
Yeah, Arshi, can you? Yeah.
I'm playing.
Good morning, Mr. X. You're early today. What's up? What's with you?
Almost done with the past and present. Let's go to the future. It's not like I imagined. The future is in darkness.
Welcome back, Mr. X. It's not your future that is in darkness. It's your eyes. You are affected by glaucoma. Please consult a glaucoma specialist as soon as possible. Otherwise, your future may become dark.
Don't let glaucoma hold you back. See the future clearly and live without limits.
Thank you. Thank you, Dr. Manju. I must say that was a very, very innovative kind of a reel. So over to you to, elaborate and quickly describe that what you try to convey through this reel. Dr.
Hi,
Manju?
good evening, everybody. Thank you for the opportunity. And it's like he built a time machine and stepped into the future. The world was dark, streets without edges, faces without clarity, paths disappearing into shadows. Shaken, he returned to the present. The message was clear. The future wasn't meant to be dark unless glaucoma is ignored. A disease that silently steals vision long before the symptoms appear. What he witnessed was a warning, not a fate. Blindness is irreversible but preventable by early diagnosis and timely treatment. Regular eye examinations can change the future. Treat glaucoma today so your tomorrow doesn't fade into darkness. Thank you.
Thank you, Dr. Manju, for your efforts and that brilliant reel. I'll request Dr. Satin, sir, if he's around to say a few comments. Okay, I think sir had some other meeting to attend.
No.
Sir's there?
I could just see a little
Yes,
bit,
sir. Yeah.
but I think it's better if we can ask someone to give their comments.
So
I
please,
just saw
we'd love to hear from you, sir, if you can, if you've.
I just saw a little bit of it because it was too noisy here.
Sure, sir. Sure.
So,
Okay, so we'll request Dr. Swati ma'am to give a few comments on that reel. Over to you, Swati ma'am.
Thank you, Nupur. And congratulations, Manju. You have done a good job. And, we normally ignore, people normally ignore what they have at hand in present. And once you show them what's there in the future, then they realize what they're missing in the present. So giving a futuristic vision, it's a good idea, actually. I mean, I think not just restricted to 30 seconds or 1 minute, you can just make it as, into a small video so that you can show more of what patients can lose if they don't come for a follow-up, if they don't put the drops. You can make it a little more informative. But
Yes,
good
ma'am.
job.
Thank you.
Really good
Yes,
job.
ma'am. So the limit of this contest was a 1 minute reel. So, but point well noted, ma'am, and I'm sure Dr. Manju would work on it and try to come out with a more longer video for the public awareness as well. Thank you, ma'am. Dr. Ramyashri, your comments on Dr. Manju's reel. Yeah.
Thank you, Nupur, and congrats, Manju, for participating here.
Thank you.
The concept of the time machine has been really commendable, from present to past and then coming back to present. One thing which I lacked is which I felt, is the clarity on the vision losing. Of course, it is very subtly shown in the the frames that he's having clear vision and then it suddenly becomes blurred and then the vision goes away. It could have been a little more elaborate on that, or maybe the timing should have been a little more prolonged, which would have made things better to grasp. If somebody looks at this reel, it looks like a very hi-fi movie, but doesn't register well unless because you have explained it post the real presentation, we could get it. But sometimes it's a commendable effort, I must say. Very good. Please keep doing it, and all the best.
Thank you.
Thank you, Dr. Ramyashri. Dr. Franco, your comments on that innovative concept of time machine and...
Hi, everyone. Thank you for the presentation. I really like the futuristic concept and the message about, early detection of glaucoma is really creative way to raise awareness. I think well done. It's a really good concept for a young people and young patients. So thank you.
Thank you, Dr. Franco. Thank you, Dr. Manju. You've participated in the previous seasons as well, and you've always done a wonderful job. You come out with brilliant, innovative things. Thank you for your submissions again. And please keep submitting again and again. And it's a pleasure to have you. Thank you. Thank you. Thank you. So we have our next participant, Dr. Megha. So she's a MS gold medalist from MMCNRI Mysore, and she's a DNB gold medalist. And she's done a glaucoma fellowship from Arvind Eye Hospital, Pondicherry, and her special interest is sustainable lifestyle. And we'll be first having a look at her artwork. So over to you, Megha, if you can just describe what this artwork is for our judges.
Thank you, Dr. Nupur. So this is basically a rangoli which we had done to create awareness about glaucoma. So it was done using various colors which were done at the entrance of our hospital. So that, and beside this, we had kept an exhibition related to glaucoma. So as soon as the general public sees this, they think it's something innovative and they come near this so that we attract them towards the exhibition. We had basically done this. So since it looked very beautiful with each layer showing the various layers of the eye and the pressure and the glaucoma, I thought I'll put it up here. Thank you.
Thank you, Megha, for that wonderful artwork. Satan sir, if you are around, then if you could just catch that artwork, if you can just say a few words, if you are there, sir. Okay, so we'll request Dr. Alka ma'am to make a few comments on that innovative rangoli.
This is a beautiful rangoli. I think once the patient enters, and he'll be curious, he or she will be curious to know what it is. So they'll be keen to learn about it. So I think it's a beautiful rangoli. Great, Dr. Megha.
Thank you.
Thank you, ma'am. Next, I'll request Dr. Allen, Dr. Allen to comment, to say a few words about this artwork. So, Megha, can you just, I'm sure you would want to tell Dr. Allen what rangoli is actually. You can just give a short, for our international judges as well. If you can tell what rangoli is, and then we can take the comments from Dr. Allen.
Yeah, Rangoli is basically an art form wherein we use various colors and basically done as a festival thing to invite good fortune into the home. But it's turned more into an artistic thing these days with which we use it to create awareness or send across messages. So this is done on the floor
So
with various colored
basically,
powder.
yeah. So rangoli is something which we do it on the floor. It's not a paper or a pen kind of a thing. We have these powdered colors wherein we use it to design. So you can understand how much effort it must have taken with the powdered colors to make it on the floor, to make the outlines and think of a concept. So that's what for the international judges, and this is what rangoli is all about. So Dr. Allen, a few comments from you regarding this unique artwork form. Dr. Allen? Okay, so I think Dr. Allen, I think, is facing some issues with her network. So Dr. Maria, we can have a few comments from you. Dr. Maria?
Hi, yes. I really like the bright colors that she put in her artwork. It's really interesting for us to understand the meaning of this type of artwork. I really like the words that are just at the bottom. The world is bright, save your sight. I think it's a really interesting message for all patients that is short, but it's really sticky to the head, like the importance of why having an evaluation, it's so important to preserve their sight. So it's a really wonderful work.
Thank you. Thank you, Dr. Maria. Next, I'd like to invite Dr. Iqbal Iftikhar to give a few comments on this wonderful artwork.
Hello, everyone. Thank you, Yosi, for inviting me. Actually, it's a very colorful image of what we always see in different textbook or in the website whenever we search for the glaucoma. So I think it's very, very much relevant to the glaucoma week this time, and it's actually showing how it affect the glaucoma optic nerve as well. As you can see, it's in front of the hospital entrance. I think it will draw much more audience whenever they cross it, as it is too much colorful. And I think it's very important to note that in hospital there are some pediatric patient as well as the young patient as well. So whenever they see such thing, I think those who can, almost every child can search the Google or use the mobile. I think they will look for it, and I think they will help to understand what is glaucoma next time. I think that's a very, very interesting thought, and that's what came to my mind whenever I see this image. So very well done, Dr. Mega, and thank you.
Thank you. Thank you so much.
Thank you, Dr. Iftikhar. Thank you to the judges for their comments. And thank you, Megha. We have 2 more entries from you, which we will be, I think the next is going to be played. Over to you, Dr. Arshi, for the next set of entries.
All right, so we again have our very talented Dr. Megha with her second entry, which is a reel. Judges, please note she has another reel which has to be judged later, which Dr. Nupur will tell us about. So Dr. Megha, I'll play your reel first and then you can play comments on it.
A small injury, a silent risk, a moment of fun. A hit to the eye, nothing serious, right? Redness faded, no pain, life just moved on. But 6 months later, the vision isn't the same. It's subtle, it's silent, but it's blurry. An eye injury can cause raised eye pressure, can lead to glaucoma. Yes, even after months after the injury. If you have had an eye injury, don't ignore it. Get your eyes checked. Early detection can save vision. Injury today, glaucoma tomorrow. Do not wait.
Thank you, Dr. Megha. Over to you to explain about your reel and talk about it.
Thank you, Dr. Arshi. I think the reel was
self-explanatory.
Self-explanatory. Many of the times when we are telling about glaucoma and glaucoma awareness to general public, we mainly concentrate on primary glaucoma and think about, everyone get yourself checked after 40, but many a times we forget about secondary glaucoma. So I thought something like this will help us educate the general public more about secondary glaucomas, wherein many a times they may ignore the trauma because it was trivial, but it might have led to some angle recession or something else and led to glaucoma as well. So I wanted to focus more on that. So thank you.
Thank you, Dr. Megha. Dr. Mayuri ma'am, could we please have your comments on the reel?
Yes, she has covered a very, very important aspect of the glaucoma, which is most of the time has been missed. Unilateral glaucoma following trauma is so common, and it is must that you counsel your patient about the lifetime follow-up in such patients, and that is what she is trying to cover in this. So excellent, very good.
Thank you, ma'am.
Thank you so much, Mayuri ma'am. Dr. Kirti ma'am, your comments, please.
So,
Dr. Kirtana?
yes, am I audible?
Yes, ma'am.
So I think secondary glaucoma, very rightly said by Megha, is not often talked about, So traumatic glaucoma is something, shuttlecock injury or a ball injury, and it just goes ignored. And it happens to young people. This type of glaucoma happens to young people who are busy in their regular lives, dealing with work pressure. So it's very important that this message goes that any trauma to the eye, get yourself screened within 3 months or 4 months before the vision hits. So I think that's a very, very important concept and nicely dealt with, very simplistically and nicely dealt with.
Thank you.
Thank you so much, Kirti ma'am. Can we have Dr. Anna Kagung ma'am? Can you please comment on this reel?
Okay, thank you, Dr. Mega, for sharing your artwork, and I really appreciate it for the creativity and the message that you are delivering about the glaucoma awareness, because glaucoma can also occur as result to the trauma. And this reel, we can clearly see the management, and I think it will give a more impactful message to others. And I like the last message you give on this reel, like injury today, glaucoma. Yeah, that is, I think it's the impactful message for others. Thank you, Dr. Mega.
Thank you for noticing the subtle points. Thank you.
Thank you, Dr. Agung. So we'll move on to the next artwork. This is by Dr. Kirtana. Dr. Kirtana is a MS Ophthalmology Junior Resident in her final year at JIPMER, Puducherry. Dr. Kirtana, I can ask you to unmute yourself and
Yes, ma'am.
please discuss about your artwork.
Could you hear my voice, ma'am? Hello?
Yes, we can hear you.
Yes, ma'am. As we know, glaucoma is called the silent thief of sight because vision loss occurs gradually without symptoms. Here we can see a masked thief stealing your vision without your knowledge. And in left side, we can see how a normal eye will see. That is full clear image. And next to that is the picture of the vision affected by the glaucoma. That is some areas of darkened areas and missing areas due to the optic nerve damage. I have emphasized on the family screening also because glaucoma can run in families. So even if you diagnose a person with glaucoma, we should ask his family members to get screened as well. So as we know, prevention is better than cure. So do regular eye checkups and then get it yearly treated. And then all these are background. I have used green color. As we know, glaucoma green color we'll use. And then the green ribbon represents the awareness, symbolizing hope and the proactive eye care. Thank you, ma'am.
Thank you so much, Dr. Kirtana. Very creative. Dr. Swati, ma'am, could we have your comments on this art? Yeah, Kirtana, congratulations. This is a little bit more informative than what Anirudh had, but both are conveying good meaning, and it's this is more colorful, I would say, and more information is going through one art. I like it very much. So good. Congrats.
Thank you.
Thank you, Swati ma'am. Dr. Ramya Shri ma'am, your comments, please.
Yeah, thank you, Arshi, and congrats, Kirtana, for this piece of artwork. Wonderful concept that you have gotten here. The person can see, how can he see through the normal eyes and glaucoma eyes with the peripheral vision coming down like a tubular vision, and the importance and what information, powerful information that has to go to the public has been clearly depicted here, that it is a silent thief of vision and what is the need of a family screening and what is the treatment. Although very subtly combined in this optic nerve, which is to be preserved, as you've written the message that do regular eye checkups, and that it can steal the vision is a powerful message that you have given here. Good job. All the best. Thank you.
Thank you,
I
Dr.
have a
Ramya ma'am.
question. Arshi, can I ask one thing?
Absolutely, ma'am.
I wanted to ask what software you people use to make all these artworks, like
iPad only. iPad.
Okay.
Dr. Franco, if we could have your comments, please.
Yes. Hello, Doctora Kirtana. Thank you very much for your presentation.
Thank you, sir.
I really like how this artwork compares like the normal one with the disease. So this is a really clear message, I think, and the responsibility of the family, that's really important, I think, and the idea of the glaucoma as a silent thief is explained very well. So well done.
Thank you, sir.
Thank you, Dr. Franco. Dr. Kirthana, did you plan the tricolor theme, or is it something that just came without?
Which one, ma'am?
We
No,
have
no,
the
no.
Indian tricolor over here. Okay, all
No,
right,
no.
perfect. So we'll move on to the next
Can I just
entry.
make one comment on this? I
ma'am.
think she made a spectacle out of the normal eye and the glaucoma eyes, right, Kirtana?
Yes.
And the glaucoma one was a spectacle with the constriction. So you used that
Yes, ma'am.
Gandhiji's Swachh Bharat very beautifully. And the family screening is something which is really, really
Yes,
very
important.
Thank you, ma'am.
Thank you,
So
ma'am.
we'll have the next entry by Dr. Nisha Duniwal. She is a postgraduate at ICare Eye Hospital in Noida and a third-year DNB resident. Dr. Nisha, if you could unmute yourself and please describe your art. Dr. Nisha, are you here? I don't think she's here, so I will describe it for the judges. So this is a poster that was designed to mark the International Glaucoma Week and to emphasize glaucoma as a chronic progressive optic neuropathy that remains a leading cause of irreversible blindness worldwide. The concept highlights the importance of early detection, risk assessments, and regular ophthalmic evaluation, as the disease often remains asymptomatic until a significant visual field loss. So we can invite the judges' comments now on this. So I would request Dr. Alka ma'am, if you could please opine on this art.
Okay, this is a beautiful artwork, and she has combined all the relevant points required in glaucoma. Just that the points to be seen in the for detection of glaucoma are written verbally. It would have been better if she would have made more kind of what to say. The eye shown above is just an eye, but the points written below have been highlighted beautifully.
Thank you, Alka ma'am. Very pertinent points. Dr. Aline, if we could have your comments, please. Dr. Aline? So we'll ask her for her comments later. Dr. Maria Isabel, could we have your comments on this art?
It's really important that she included prevention, family history, and also like the early symptoms that you can find. It will be really interesting for her to explain what her point of view was like for the top part, but it's a really nice job.
Thank you so much, Dr. Isabel. And Dr. Nupur, would you want me to ask someone else instead for their comments, or should we
I
move
think
on
we
to
can
the
move
next?
on. Yes, yeah. We can just
All
move
right, over to Dr. Lippy for the next presenter.
Thank you, ma'am. So our next presenter is Dr. Vibha Singh. She is an assistant professor at Santosh Medical College, Ghaziabad, and her submission is a reel. Yeah.
Every single dream come true. Reach out for the masses, history makers. This will be the greatest time of all. 'Cause we're gonna make it. Yeah, we're gonna make it.
I request Dr. Vibha Singh to unmute herself and please elaborate her reel.
Very good evening, everyone. I'm audible.
Yes,
Yes.
ma'am.
Thank you, Yoshi, and it's a privilege to be present in front of such esteemed judges. My wheel just signifies whenever any patient comes. The glaucoma patient, it's a just incidental finding in OPD when we are going to just do a conduct evaluation. If we have some suspicion, then we will go for some other tests as gonioscopy, visual field, and intraocular pressure, central corneal thickness. And then we have a finding regarding a family history or age and other risk factor. The picture I just put in a last slide. It is a red in red. If the patient is having a angle closure glaucoma incidence in previous days, then it should be treated according to that. If in the visual field it is in red, patient is having the open angle glaucoma, so it should not be red in red. So my red color in picture signifies we should beware the patient, just brief the patient for a risk factor and keep eye on the follow-up and just preserve the sight with whatever patient come to us. Thank you.
Thank you, ma'am. I would request Dr. Iftikhar sir for his comments.
Thank you, Dr. Viva, for your nice reel. Actually, it's very vibrant and very colorful. But the thing I want to judge about the overlay of the trends you are using. Otherwise, you have shown everything. What glaucoma can affect in your eyes or in later, and patient can understand it very easily. But I would recommend remove the overlay which you have used so that everyone can understand what's going on. Thank you.
Thank you, sir, for your feedback. Dr. Mayuri, ma'am, your comments.
It is a nicely made thing, but I would rather say that not so much of message is given as a awareness. One symptom is shown that there is a loss of vision, peripheral field, and we can help you if you have the problem. See the doctor and manage it accordingly. But for awareness, I think we could have more into this reel rather than just only one symptom.
Thank you, ma'am. I would request Dr. Kirti, ma'am, for her comments.
Yeah, I also had this overlay which was coming, it did not allow me to read everything. So that overlay should not be done. And otherwise, this message was about the restriction of the field was there. But what Madam spoke about the gonioscopy and the field did not come through in this investigations, did not come through in the reel.
Thank you.
Thank you. So our next submission is also by Dr. Vibha Singh. It is an art, and I request Dr. Vibha to please explain this.
In this sketch, I just wants to give the patient is having as a glaucoma is also a nightmare for ophthalmologists also. We just brief the patient if there is any glaucoma suspect about all the risk factors. If we are having anything going to start in form of drops or just we ask the patient to come in follow up for the regular pressure evaluation, and other family members also we just ask to come for the regular follow up. Thank you.
Thank you. I would request Dr. Swati, ma'am, for her comments.
Yeah. Good job, Dr. Viva. And I like the concept. The way you have drawn is good. But it's a little the back person is a little scary, kind of the glaucoma, eye injury, steroid, and family history, eye pressure. So I think if we can convey these risk factors maybe in a less what should I say, scary manner. Little, I mean the red hands.
I think, ma'am, what she's trying to convey is probably the silent thief of sight, with that mask on and the red hands trying to steal away the sight from the patient. So I think that's what she was trying to convey through that. So
But
that's
overall good attempt. Yes.
Yes.
Thank you. I would request Dr. Dia for her comments.
Dr. Anna,
Congratulations.
please.
Yeah. Sorry. Dr. Viva, I think we know that many factors can contribute to glaucoma, and I think you want to represent the risk factor around the character, and if the ideal to contribute what what kind of factors can make the glaucoma. The artwork communicates the idea in a very creative way. Thank you, Doctor.
Thank you, ma'am. I request Dr. Ramya Shri, ma'am, for her comments and feedback.
Thank you, Lipi, and congrats, Dr. Vibha, for this artwork. So I have a couple of comments. The artwork is very powerful in the perspective of showing the risk factors like glaucoma, which is caused by eye injuries, steroids, which is the important thing, family history and eye pressure and high BP. From an artistic perspective, if I can talk, because I'm a little bit of a hobby artist. So if I can talk from the artistic perspective, the other way around would have been, like the glaucoma injury and the whatever ghost-like image that you have created could have been a little more bigger, and the human perspective that you have formed, that you have created, could have been slightly on the smaller aspect, and the eye or whatever else could have been differently, creatively highlighted. That's my perspective. That's completely on the artist perspective. I agree with whatever you have done. Good attempt. Keep doing. All the best.
Thank you so much. The points are well noted. Dr. Vibha is a very active participant in all the YOSI activities. Thank you, Dr. Vibha, ma'am. So our next participant is Dr. Kanchan Sharma. She is a DN third year resident at Eye Care Eye Hospital and PG Institute, Noida. And her submission is an art on glaucoma. Please unmute yourself and explain the art.
So, hello, good evening, everyone. Myself, Dr. Kanchan Sharma. So, this is an art which I have prepared to basically show that how glaucoma is the silent thief of sight, which still remains the leading cause of irreversible blindness in the world. So, in this poster, it shows the contrast of the consequences of an undetected disease. So, on the darker half, it represents the silent progression of glaucoma and how the world can appear to be for a person who doesn't get treatment on time, with elevated intraocular pressures, field vision loss, then irreversible damage, and which often remains unnoticed till the advanced stages. And in the contrast, on the brighter half, which symbolizes the power of early detection, community awareness, and the help of treatment, like we have eye drops, laser, or be it the conventional surgeries. So I think we as ophthalmologists, we play a pivotal role in early detection of the disease, since the patient doesn't come to know when the patient has glaucoma in the early stages. So we can help them to for the same by detecting it early and change their life in a longer run. So, yeah.
Absolutely. Thank you, Dr. Kanchan. I request Dr. Franco for his comments.
Thank you, Dr. Hassan, for this presentation. Well, I think I need a little bit time for analyze, but I really like how this artwork shows the contrast between vision loss from untreated glaucoma. So
Yes.
maybe this will be for another kind of patients, not the young ones. I mean, in a hospital or something more with more information about the treatment. So it's a really good art. So nice job.
Thank you so much. I request Dr. Alka ma'am for her comments.
The contrast between the glaucoma and the treatment has been beautifully depicted. But just the slide is slightly congested, so it could have been more kind of.
Just I wanted to add a lot of things, but I know I should be more
Yeah, but
careful.
it's
Well,
beautiful.
sorry
The
for doing that.
contrast is beautifully depicted. Very
Yes,
nice.
ma'am.
Thank you, ma'am. Dr. Aline, your points and comments.
I think we've lost Dr. Aline in her network. So I think we can move on to the next entry.
Yeah, okay. So our next participant is Dr. Achal Singhal, and he's a glaucoma fellow at Shroff Eye Center, and he has submitted a reel. Can we move on to the, yes.
काला मोतिया ग्लोकोमा, इससे मेरी नजर पूरी तरह से चली जाएगी और पता भी नहीं चलेगा, दर्द भी नहीं होगा। सवाल बहुत है और इन्हीं का आंसर देने के लिए मैं यहाँ हूँ। हाय, आई एम डॉक्टर अचल सिंघल, ग्लोकोमा फेलो एट श्रॉफ आई सेंटर न्यू दिल्ली, और मैं आपको आज बताने वाला हूँ हाउ टू प्रिवेंट योर विजन फ्रॉम लॉस टू ग्लोकोमा। जी हाँ, व्हाट इज ग्लोकोमा? ये एक प्रोग्रेसिव ऑप्टिक न्यूरोपैथी है। ऑप्टिक नर्व जो हमें देखने में मदद करता है, ये सूखने लगती है इसमें, चाहे प्रेशर आंखों का हाई हो या ना, पल पल विजन कम होती जाती है और अंतिल जब नस पूरी तरह से सूख जाए फिर टनल की तरह नजर बचती है, हमारी पेरिफेरल विजन चली जाती है। और ये हुआ क्यों, कैसे? तो जी, अगर आप 40 की उम्र से ज्यादा हो ना, तो अपने आप को जल्दी से दिखाओ आई स्पेशलिस्ट को। और स्मोकिंग करते हो, डायबिटिक हो, फैमिली हिस्ट्री अगर आपको ग्लोकोमा हो, हाँ, जो डोले छोटे बनाने के लिए आप स्टेरॉइड यूज करते हो ना जिम में, स्टॉप दैट, नॉट टेक इट, दैट इज आल्सो रिस्क फॉर ग्लोकोमा। नाउ हाउ टू नो कि ग्लोकोमा या काला मोतिया है कि नहीं आपको? इसके लिए जल्दी से अपने ऑप्थेल्मोलॉजिस्ट या आई स्पेशलिस्ट के पास जाए। वो आपको ऑप्टिक नर्व एग्जामिनेशन करेंगे, आपको प्रेशर चेक करेंगे, ओसीटी और विजुअल फील्ड्स जैसे टेस्ट करेंगे, ताकि ये पता लगे कि जो आपको नहीं पता लग रहा था ग्लोकोमा डैमेज आपके ऑप्टिक नर्व में है या नहीं, वो है या नहीं। इस चीज को डिटेक्ट करेंगे ये टेस्ट। तो रिमेंबर, स्क्रीन, डिटेक्ट एंड प्रोटेक्ट, क्योंकि हमने that you lose your vision to glaucoma and you fail to see the beautiful things.
Thank you, Dr. Achal. I think it was a very nice message. I request Dr. Maria ma'am for her comments.
Lippy, we can request Dr. Achal to say a few words if he's around, because I think he presented this reel in Hindi and probably our international judges. So if you could, Dr. Achal, you can just elaborate, what you were trying to say for the benefit of our international judges. Yeah.
Thank you, ma'am. Good evening, everyone. First of all, I would like to thank YOSI for providing this opportunity in submitting my reel for glaucoma awareness. So basically in Hindi, my aim was to just create simple glaucoma awareness. My mentors and all teachers here who are there in YOSI as well as back in Delhi, they've always taught me to simplify things. So I'm just explaining that what is glaucoma, that it is an optic neuropathy, and what are the risk factors which cause this. It can be steroids, it can be age, diabetes, smoking. And why is it important to detect glaucoma early? Because we lose our peripheral vision, we are left with just tunnel vision, and that's the reason why this disease has to be detected very early. It's a silent thief of sight. There are not many apparent or conspicuous symptoms. So detecting it is very important. Regular checks with the ophthalmologist is very important, as I mentioned in the reel. And as I said in the end, because we do not want you to lose seeing all the beautiful things in the world to glaucoma, hence it's important to get these tests done.
Thank you. I request Dr. Maria for her comments.
It was a really interesting reel with a lot of information that can be useful for patients. Maybe a little bit less time will be like for you to maintain the focus of whoever is watching it. But it was really interesting and really informative.
Thank you, ma'am.
Dr. Iftikhar sir, your comments?
Dr. Rachel, you have done a very wonderful job. Actually, I was thinking about what Nupur ma'am already said, that because most of the judges from the international faculty. So I think, but many of us actually understand what you have said, but the music was a bit louder. Okay, you have covered almost everything what the general people should know. But I think it would be better if you just put the subtitle like thing, or slow the music a bit, or lower the pitch. I think that will make a huge difference. So well done. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir. I request Dr. Mayuri ma'am for her comments.
Anchal, you have done an excellent job, but the problem here was your music was too loud. So the message
Yes,
was
ma'am.
not
Apologies
clearly
for
heard.
that, ma'am.
Secondly, whatever you have said in a very easy language. So it is good to make a good contact with the patient when you are speaking like this. But if you have added some pictures along with this, see, visuals always carry more impression for a long time rather than just talking to them. So
Ma'am,
that's
I did
why I
add a
did,
few images in the reel.
but they were not clearly seen here.
Oh, okay,
So
ma'am.
half
I'll
of the
definitely
screen
take care.
should have been your speaking the thing, and the other half should have those images. See, showing the things will give them more impression. The patients may not be educated enough, but pictures will always give you good impression.
Yes.
But otherwise, it is good.
Thank you.
I think we are so lucky to have judges give such wonderful feedback. So not only Dr. Achal, but all the participants and the moderators who are watching, we can take these small future notes to make good reels. So I think thank you, Dr. Achal, for that effort of making this reel. And I'm sure you'll make a note of all the feedback that was given to you, and you will come out with with even you've done a great job, and you'll come out with a better one next time also. And the feedback given by Dr. Iftikhar, Dr. Mayuri ma'am is going to benefit all the young ophthalmologists when they make a awareness reel next time. So
Yes,
I think
yes,
it's a wonderful
congratulating
learning.
everyone. Nupur, congratulating everyone. But
Yes.
just adding a few masala will give.
Yes, ma'am. That is what you are there for. It is, that's what I'm saying. Your comments are benefiting us also. We are learning so much, from your points of this thing. Thank you, ma'am, so much. That's what I'm saying. It's wonderful, ma'am. Thank you.
Thank you, ma'am. With this, we'll move on to the next participant. Over to you, Prasanna, sir.
Thank you, Lipi. With that, we move to the lot number 11. Dr. Suresh, can we have Dr. Shridu Suresh, Art 7.
Dr. Arshi, ma'am, can you please move on?
Yeah, so we have an art, and Dr. Shridu Suresh is a junior resident at KMCT Medical College and Hospital. Let's see, I think, yeah, let's go to our art.
Good evening, all. This painting is inspired by the creation of Adam by Michelangelo, where one hand belongs to Adam and the other to God. And my painting reimagines the iconic near touch as a moment of ophthalmic awakening. Here, the two outstretched hands belong to the patient and to us, the ophthalmologists. The small space between their fingers represents this fragile window between silent vision loss and the chance to preserve sight. Yet, within this narrow space lies hope. The almost touching hands symbolize trust, awareness, and the life-changing power of early detection. As depicted here, glaucoma silently and slowly narrows a patient's world. It reminds us that when patients and doctors come together through knowledge, vigilance, and early screening, that small gap can be bridged. So like in the painting, let's join forces and unite for a glaucoma-free world. Thank you.
Thank you, Dr. Shridu Suresh. We would like to take comments from Dr. Geeti Singh, ma'am.
So this iconic Michelangelo painting on the Sistine Chapel is beautifully depicted. But either you wanted that message of the God's hand to be the doctor's hand and the patient's hand to be the hand which seeks the trust. In that situation, you should have framed it a little bit more differently. Because here the ophthalmoscope, slit lamp, and the microscope, the message is not clear. The painting itself is beautiful, but the message for the patient, if you want it for the glaucoma awareness, the message is not, at least I can't understand, and I just could read this: knowledge should be wish. I'm sorry, could be wish, not your vision.
Knowledge should be wide, not your vision narrower, ma'am.
Knowledge should be wide, not your vision narrower. Okay, I could read the wide back bit. So, The painting is really beautiful. The aspects are there, but maybe you could reframe it of the God as the hand of God, or means the doctor and the patient, because the content has to be geared up to the awareness of the patient. That's what I felt.
Thank you, ma'am.
Thank you, Kirti ma'am, for your comments. With that, we move to Dr. Dia. So do we have Dr. Dia with us?
Yes. Congratulations, Dr. Sveto. I very like your details and beautiful paintings here. But maybe sometimes if you want to message delivered to others, maybe we need to a hook to catch the viewer attention. So maybe for me, I will focus into one or two paintings, and maybe the bigger picture, so we can see focus on the one or two picture, so your message will deliver to others with a good and impactful message to others. Thank you, Doctor.
Thank you, Dr. Dia. Swati ma'am, can we have your comments, ma'am?
Sritu Suresh, it is a very, very nicely clean painting, what you have made. There is a lot you want to say, but you have assumed that the patient knows most of it. So, presuming that the patient doesn't know anything of it, or a lay person doesn't know anything about glaucoma, doesn't know about the microscope or the slit lamp or anything. So, what Kirti madam said that, yes, the concept of you would have labeled patient's hand or God's or doctor's hand, and then, more information would have gone to make a lay person understand. But the painting overall is, your effort is seen here very clearly. So it's beautiful, but a little bit less informative for a lay person. We are not just seeing the patients; we are educating the bystanders, the local people, the illiterate people. I mean, they should, seeing the painting itself, they should, oh, this is something which I should be worried about. So you can make a little bit of more information into it, but artistically it is beautiful.
Thank you.
Congrats.
Thank you, ma'am. With that, we will move to lot number 12. Dr. Ritika Jadhav, who's having a reel, and she's a second-year DNB resident at Arvind Eye Hospital, Salem, Tamil Nadu.
In this World Glaucoma Week, we will be interviewing general population to know about the awareness of this disease.
Glaucoma patient வந்து பாத்தீங்கன்னா அது அனுபவம் சுகர் வந்து கண்ட்ரோலாக தான் வச்சுருக்கோம். பட் ஆனால் கிளைகோமா வந்து கொஞ்சம் கொஞ்சமாக அப்படியே அரெஸ்ட் ஆகிட்டே இருக்கும். இந்த பக்கம் பக்கம் பார்வை அப்படியே கொஞ்சம் வந்து இந்த இடத்துல ஒரு 25% வந்ததுன்னா இங்கே ஒரு 10% மறைஞ்சிது. இங்கே 30% மறைஞ்சதுனாக்கா இங்கே 20% மறைஞ்சிது. அப்படியே ஓவராலாக பார்த்தீங்கன்னா கிளைகோமா வந்து அது ட்ரீட்மெண்ட்டே கிடையாதுன்ற மாதிரி டாக்டர் சொல்லிடுறாங்க. அது முடிஞ்ச வரைக்கும் இருக்கிறத வந்து காப்பாற்றிக்கலாம்.
Glaucoma is known as silent thief of sight because early stages often have no symptoms. Risk factors are age more than 60 years, positive family history, thin corneas, and long-term use of steroids. Treatment is medical, that is anti-glaucoma medications in the form of eye drops and oral tablet, and surgical. So get yourself checked today.
Dr. Prasanna, sir.
Thank you. Yeah. So thank you for this wonderful reel, Dr. Ritika. With that, we will take the panel discussion from Dr. Amyashri ma'am.
Yeah, Prasanna, we can invite Dr. Ritika if she's around to just say a few
Okay,
words.
okay. Yeah.
Dr. Ritika, are you there?
Yes, ma'am.
Yes.
Hi, yeah.
Good evening, everyone. This is the first time I'm participating in YOSI. It is very grateful for opportunity. Thank you, ma'am. Thank you, sir. This we actually went on a Sunday camp in Arvind Eye Hospital. So me and my co-resident just asked the patients who came for the camp whether they are aware of the glaucoma, what is glaucoma symptoms. So I saw there is very lack of awareness in the general population. So it is very important to increase the awareness, ma'am, so that a patient can get to know about a condition earlier, so that it can be diagnosed better early and started treatment. So this was a small attempt from my end. Thank you.
Thank you, Dr. Ritika. With that, we'll move to the comments from the judges and the panel. Dr. Rameshri. Yeah, Dr. Rameshri, ma'am, you're there.
Yeah. Thank you, Dr. Prasanna, sir. Congrats, Dr. Ritika, for this first attempt, probably, that you have done. Good one. Few comments here. The awareness among general public is less. Yeah, that's what you're trying to show. But could have been a little better if I look at it from a artistic perspective. The overlays or the captions that you've written are really, really small. Could have been bigger for people to see and understand. The wordings and the caption, the video that goes behind and the captions, there is some lag. Maybe that could have been optimized. And in the end, you could have had it. You could have had wordings to say after 40 and all those risk factors, maybe as bullet points in the end, just to complete and give a good picture about it. Could have been much better. Anyway, for the first attempt, really, really appreciating for it. Thank you and all the best.
Thank you, ma'am. With that, we will move to Dr. Franco for his comment.
Thank you, Dr. Ritika, for this presentation. I really like how you directly interact with the patients. So I think that's really good one. And ask about their knowledge of glaucoma. So this approach is very valuable because it helps us to understand the level of what people know about glaucoma. And also, I will encourage continue this work by giving people a simple tools and information so they can learn more about the glaucoma. So well done.
Thank you, Dr. Franco. With that, we'll move to Dr. Alka, ma'am, for her comments.
The starting of the video was beautiful. She has highlighted a very important concept, that there is a very much lack of awareness among the general population. So we all should work on it, and we should create more such videos to tell the general public that glaucoma is a reality, and you should be aware of it and get yourself checked. But the end of the video could have been better. But overall, a beautiful concept she has brought.
Thank you, ma'am. Thank you to all the three judges for your wonderful comments. With that, we'll move to the last set for today, the last speaker, Dr. Surbhi Jain, who's actually a junior consultant, the Sight Avenue, and she's going to have an art. Yes. Dr. Surbhi.
Dr. Surbhi, are you there? Okay, so I think Dr. Surbhi could not join, but I'll just describe the artwork. She sent a description. I'll just read it out. So glaucoma is a silent, devastating disease that can steal your sight. And while treatment can control it, there is no cure. This poster urges everyone to safeguard their eye health by getting regular eye checkups and paying attention to seemingly innocent symptoms that could signal trouble. Recognize the warning signs: headaches, frequent glasses changes, eye redness, eye pain, nausea, blurring of vision, or difficulty in focusing, and act now to preserve your eyesight. This poster combines awareness of glaucoma seriousness with a call to action for routine eye examinations and vigilance about early symptoms, encouraging the public to protect their vision proactively. Over to you, Dr. Prasanna.
Yeah, thank you, ma'am, for stepping in place of Dr. Surbhi and getting the presentation done. We'll move to Dr. Aline for a comment. Dr. Aline, if you are there. Okay, we'll move to Dr. Maria.
It's a really beautiful presenting what we already heard. Symptoms, what patients can present. I really like the perspective of the colors the doctor chose. And for me, it's really beautiful and simple. It doesn't have a lot of information and it goes straight to the point.
Thank you. Thank you. With that, we'll move to Dr. Iftikhar for his comments.
Okay, it's a very colorful image actually. So, and she mentioned all the warning signs which we shouldn't miss during the evaluation of glaucoma. But the thing is, it's though it's quite beautiful, but do you think it's really express the awareness we want to create at this week? I think it's a bit it's a bit low, but sorry for the comment because I need to judge something. But the thing is, it's very wonderful. And I want to add one thing for those who are using the artificial intelligence to create the images. You have to make sure you have to show something different. You have to show something on your own to make it a bit different from the what's AI generated and what's on your mind. So I think that will create a huge difference. So that's all. I think it's a very wonderful image and it's very beautiful. Thank you.
Thank you. Thank you, Dr. Surbi, and thank you to all the judges and the panelists. I think that
Prasanna,
brings
we
it.
have one more entry.
Okay,
Which,
okay.
yeah.
You want me
So,
to?
Arshi, if you can
Yeah.
stop sharing and Lippy can share that. So, judges, please know that there's one more reel by Dr. Megha. If you can add that to your Excel sheet as well. There was a glitch from our end and from the moderator's end. So, we apologize for that. So, there's one more reel. This is the second reel by Dr. Megha, and we'll request you to judge that as well. So, if Lippy, you could just play the reel. Yeah.
A grandparent's wish, a future they can see. A grandparent's love is endless. The bond between a grandparent and a grandchild is irreplaceable. But what if they couldn't see the kid run or smile? Glaucoma is a silent thief of sight. It takes away sight little by little, but once gone, it's forever. The father remembers how his grandfather had lost vision to glaucoma. They go for an eye checkup. With treatment, glaucoma can be controlled and sight preserved. Glaucoma runs in families. If it took his grandfather's sight, if it's affecting his mother, could he be next? The father takes an appointment for himself too. A simple test today can save a lifetime of vision. Know your family history, get tested, protect your sight before it is too late.
Megha, if you're around and you want to say a few words, I think that was a beautiful video. Yeah. Hi, Megha. Yes.
Yeah. Thank you, Dr. Nupur. Instead of bombarding many things in one single point, I thought we'll just highlight one thing about family history. And if you put in our family into the reel, it gets more connected to the general public, is what I felt. So, with just a simple thing, I felt I talk about the importance of family history in glaucoma and glaucoma screening.
Thank you, Dr. Megha. And Dr. Mayuri, ma'am, your comments for Megha's reel.
I think this is one of the very good video. A good message, and when you touch grandparents, the children will take it. So it's a good as a awareness, and family history is so important in glaucoma patients. And we always advise at family clinic, they should go and see that for the early detection. Very nice, very nice.
Thank you, ma'am. I
Thank
saw
you.
Dr. Alka, ma'am, giving a clap sign. So, Alka, ma'am, your comments, if you want to say that in words to Megha.
Beautiful video, short and sweet, but a beautiful message for the general public. Very, very beautiful video.
Thank you. Dr. Iftikhar, your comments on that reel.
Yeah, it's really beautiful actually, because whenever you see your grandparents in the scene, as well as the general people will know what is going on and what will be the next. So I think it's a very, very well received message from the presenter. Thank you.
Thank you.
He has touched two things. One, graveness of the disease is also being highlighted. that you cannot see the beautiful world. And then it is family history. So very nicely. 1 point is taken, but 100%.
Thank you.
Thank you.
So with this, we come to the end of all the entries. And I'll request the judges to mark this as the 14th entry by Dr. Meghaji, and please mark it on the Excel too. We've not mentioned it for you, but if you can just do it and give the marks for this as well, we'll be grateful. Now over to Dr. Lippy and Dr. Arshi to take a feedback and closing comments from the judges. Over to you, Lippy and Arshi.
Thank you, ma'am. Firstly, I would like to request Dr. Kirti ma'am for her comments and feedback about today's webinar.
No, I've already written on the chat box before you asked me for the feedback that it's a learning lesson to me of how you are our future and the youngsters, how you think and how you write and how you create. I mean, as a judge, you have to mark somebody more than less, but it's like it's fantastic. There's no two words about it. It's really fantastic. And everybody brought out their different points. And but the message I would like to give is whether it's a reel or it's a just a picture, try to add, or even in a talk. What I learned the hard way, like we have gray hair, so we can talk. Try to keep it short. It's like the KISS technology. Keep it short and sweet. Never make a slide or an artwork too noisy. Never make the reel too noisy. Just make it very simple messages. And one thing I would just like to say, uh, never that patient narrative. If you have to make an impact, have the patient narrative. Like somebody talked about how the patients perceived, how they felt, and somebody said, "I want to tell you about what is there." If I were to do it, I mean, again, that's very difficult with the confidentiality. Let a patient speak, although the time of 1 minute is not there in this. Let a patient speak if they are willing to speak, that this is what glaucoma did to me, and this is what you should avoid. And then, if you could just show a visual image of 4, 5 things which another person should know about glaucoma. Like I always show in my class a chart pie with 4 things: gonioscopy, visual field, tonometry, and disc evaluation. That all 4 have to be there. So just that this message goes that the patient knows what has to be there, and this can happen to me. So just have the patient's point of view narrative, which 2, 3 of you really beautifully did that patient narrative. The last one, and the girl in before who said about glaucoma. That is really important because that will have a bigger impact than you just speaking about glaucoma. But overall, there are different perspectives. Art is something which is very uniquely a fingerprint. So really appreciate and thank you so much for having me here. I learned a lot. Thank you.
Thank you so much, ma'am, for giving your time to all the young ophthalmologists. I request Dr. Mayuri, ma'am, for her feedback.
Ma'am, you're on mute, ma'am. Mayuri, ma'am, you're on mute.
Okay, thanks for having me here. Jain ji can do everything. Lot of creativity. They have put the things so nicely there. But as I have written in my comments, human ideas cannot be generated by AI. You can do better without using it. So very nice, very nice.
Thank you so much, ma'am. I request Dr. Anak, ma'am, for her comments. Dr. Anak, if you're there, for your feedback and your experience with today's webinar.
Thank you, Doctor. I'm very happy to be here and get to know to everyone here. And congratulations to all the participants. Your creativity and the effort for the glaucoma. And I think we make the beautiful message to others, and we will continue to inspire everyone to continue with the art and the creativity with the young ophthalmologists. Thank you.
Thank you. Dr. Franco.
Thank you very much for the invitation, Dr. Prasanna and everyone, during this wonderful World Glaucoma Week. And I would like to highlight the great initiative that colleagues in India are taking by organizations, webinars like this, which can have a very strong impact and education about glaucoma. It was inspiring me to see the creativity, dedication of all participants. So congratulations to everyone, excellent work, and it's truly an honor for me to be part of this event. Thank you.
Thank you
Thank
so
you.
much. Arshi ma'am,
Dr. Swati Upadhyay, ma'am.
Thank you, Arshi, for having me here today. And, we should have more of these events because we have a lot of talent which somehow gets takes a back seat when we are just seeing patients, managing the complications and doing surgeries and all. But all these things, have a greater impact, and it makes us feel happy. So, and I think we should have a separate next time when you people make it, you can have a handmade competition or an AI generated. So it was a mixture of both. So the hand paintings which we used to do, or when we didn't have AI or iPads, that they are more informative. I don't know. I mean, they are two different things. We should not compare the handmade things with the AI thing. So, but it's a very wonderful effort. Prasanna, Lipi, Nupur, Arshi, and everybody from YOSI. Thank you for having me.
Thank you so much, ma'am. Alka Pandey, ma'am, if you're here.
Yeah, thank you, YOSI team, for having me as a judge. It was wonderful seeing you all youngsters come up with so much content and reels. I mean, you make reels, I know, but these reels were beautiful. And as Swati said, handmade ones should have we should have a separate section for it, because AI generated, see, everybody can do, but handmades are handmades. We are old school, I know, but still.
Absolutely, ma'am. Some definitely advantages to this. We should use AI, but we should definitely not lose our creativity.
Yes.
Dr. Iftikhar Iqbal, please, sir, if you could add your comments.
First of all, thank you, YOSI, for inviting me, especially the Dr. Prasanna. He's a very good friend of mine. So whenever he called me, okay, you have to be here, and I'm always here for the YOSI. And the thing is, it's very wonderful. Whatever they have created, it's just amazing. But the thing is, you have to make sure it's a bit relevant to the field or relevant to the topic you are going to message or you are going to deliver to the general population, because not everyone will understand how you can say or how you can present to the audience. So you have to make sure whenever you create reels or something like that, it goes to the general population, your target audience. And another thing is, make it a bit shorter and deliver much as possible in a simple way. It may be the patient communication, it may be in a graphical presentation or whatever it is, but make sure it can take up by the general population very easily. And finally, it's very well done, and very well done by the YOSI as well. Thank you.
Thank you so much for your pertinent comments. Dr. Ramya, ma'am.
Kudos to YOSI team for having curated this event, and thank you for inviting me here. It's a great learning to me, learning about how an artwork can create awareness among the general public. My only thing is, there are few who have given their artwork with an emotional touch, and I like the concept of time machine, and the last reel by Dr. Megha with that human and family touch. That has been really wonderful. I would like to echo what Dr. Kirti madam has said, that to keep it very simple and less noisy. Yeah, and I would also echo what Dr. Mayuri ma'am told, that AI cannot replace human creativity. The one thing that I have been using AI for some of my other projects. So it is the prompts that we give them with our creativity, it is what creates, but we tend to use it. But my suggestion is to not overuse the technology that we have and retain our own creativity in getting things up. That can touch the human hearts and mind and souls. Excellent learning. Thank you. Thank you so much, Yosi and Dr.
Thank you
Prasanna
so
and
much.
Dr. Arshi.
Thank you so much, Ramya ma'am. Dr. Maria Isabel, if you hear,
Yes, it was a really amazing webinar where we could see the perspective of every one of the contestants and what they perceive as the disease and how patients see it, and also to make awareness. As they were commenting before, the creative work of the human cannot be replaced by artificial intelligence. So it is really nice to see the effort that was put into every work, and also to integrate the medical part with the creative part. Thank you.
Thank you so much. Dr. Lippy, we've covered everyone.
Dr. Aline.
Dr. Aline, I think, has left the webinar.
Okay, we can move in. Dr. Nupur, ma'am.
But
Yeah.
thank you to Dr. Aline for being there, actually.
Yes. So thank you to all the judges for taking out time. I'll request you to stay back for 2 more minutes because we really want to have a group photo with all of you, with all the judges and the participants. So this is the YOSI membership. Those who are watching on YouTube or will watch it later, or probably are live in the webinar. If you're still not YOSI members, you can become one and be a part of this wonderful YOSI family that we have. Your wonderful opportunities. This webinar is just one of them. And we have a plethora of activities. So do become a member if you're under 40, and if you're in training, or if you've completed training in under 40. And also, I'll request Dr. Prasanna to, formally invite everybody to YOSICOM. Prasanna, over to you.
Yes, ma'am. Yes, ma'am. Thank you, ma'am. And to all the viewers seeing this, July 10, 11, 12, we have our third annual conference, which is again going international for the third consecutive year. So we would like all of you young ophthalmologists, wherever you are, including our mentors as well, as we always look up to our mentors, to also be there, bless us, and we'll have a fantastic YOSICon with YOSI for Life Resident Power, and can see the hashtag Med Education. Thank you.
Thank you, Prasanna. And I'm sure we'd like to extend this invite to all our senior judges also today. Please come and bless us in person for YOSICon. It would mean a lot to us. So with this, we come to the vote of thanks. So this is the email ID. If you have any feedback regarding this event or any event regarding social culture, you have any ideas what can be done, what can be incorporated, this is the email ID for you. You can write a feedback. You can get in touch with any of us, me, Dr. Lippy, Dr. Arshi, Dr. Prasanna, and you can give your feedback. So first of all, a huge thank you to our esteemed panel of judges, our seniors, Dr. Kirti ma'am, Dr. Mayuri, Dr. Swati, Dr. Ramya Shri, Dr. Alka, our international friends, Dr. Franco, Dr. Anak, Dr. Aline, Dr. Isa, Dr. Dr. Iftikhar for joining us today, our chief guest, Dr. Satan sir, Dr. Madhu ma'am, your wholehearted involvement in this event. I think your mere presence was such a boost to this entire event, and all the participants were super excited to be presenting in front of you. So thank you for taking out time from your busy schedules, being with us, giving us such wonderful learning points, and commenting on each and every entry from the creative and the clinical perspective as well. Thank you. A heartfelt thanks to all the participants. I think with the busy schedules, it takes a mammoth of effort to even think of participating and submitting. The time was a little short. I think we just gave around 1 week, 10 days. But with this, you made an attempt to come out with something creative, and I'm sure that you will learn from all the feedbacks that were given to you by our esteemed judges, and you will come out with better things in the next. And we look forward to having all of you for all the future YOSI activities as well. huge thanks to all the audiences, who've been watching this, or, either live or are watching on YouTube. And last but not the least, a huge thank you to the entire co-moderated team, Dr. Arshi, Dr. Prasanna, Dr. Lippy, for such an excellent and seamless, flawless teamwork. It's such a pleasure to always work with you all. Right, it is such a clockwork, Prasanna getting our international friends on board, Arshi working with our senior panelists for the glaucoma group, Lippy coordinating with all the participants. So thank you, and thank you to the entire YOSI Governing Council,
And
Dr. Nilesh. Yeah, let me just complete that.
no,
And
not
they've
complete.
been very, unwavering support to all the social cultural activities, to our out of the box and sometimes a little insane ideas. They've never questioned us, given us a free hand. So thank you for that. Yes, over to you, Dr.
And thanks to you, ma'am, the other co-moderator. That is very important. I wanted to interrupt you there because we are doing it for the fourth consecutive year social
Third,
culture.
yes,
And, yeah,
yes.
fourth year stepping into it. And thanks to Nupur ma'am for bringing all of us together, seniors, juniors.
And for spearheading and always leading from the front for us.
Thank you,
Yes,
ma'am. And
absolutely.
4 countries were part of it, as 5 countries along with India, Bali, Mexico, Bangladesh, and
I think that was something
and Sri
amazing.
Lanka.
So I think this also has a potential to create so much impact, getting this global of how we have all actually united for a glaucoma-free world in our effort. So this goes so well with the theme of this World Glaucoma Week this time, uniting for a glaucoma-free world, and hoping that more and more awareness gets created and we someday achieve that dream of a glaucoma-free world. So that's it. And thank you to Numerotech, Manjula ji, for a long webinars and the tech support. And I hope, Prasanna, I've not missed out anybody. So
No,
yeah,
ma'am. Good to go.
thank you. So
We'll
Manjula, we
take a
can
group picture.
yeah. Yes, the group photo. So Manjula, we can have the live streaming off and we can have the group photo with the YOSI